It was completely unexpected and, of course, very disappointing to see the attack on scientists and on science. And it's continued. In fact, it's got stronger.
In this conversation, you're going to hear about COVID, the Wuhan lab leak theory, attacks on scientists, and how we're going to get out of this. Unimaginable loss, eye contact only, longing for touch, pushback, the extraordinary becoming the ordinary. COVID has changed everything, and we still know so little about it. Hello and welcome. My guest this week is the World Health Organization's chief scientist, Dr. Soumya Swaminathan. Thank you for joining us.
Yes, thank you very much for having me on your show.
The World Health Organization was founded to guide global public health policy in 1948. You're the chief scientist. What a time to be the chief scientist. I wanted to start by asking you about the politicization of science and scientists. How have you found that? Have you been surprised by it during the pandemic?
In fact, that was one of the things I was most surprised by. It was completely unexpected and, of course, very disappointing to see the attack on scientists and on science. And it's continued. In fact, it's got stronger over the course of the pandemic. And, well, I think it has the potential to do a lot of damage. And it's one of the areas that I think we'll have to think very seriously about going forward, not just dealing with the pandemic, but in general, when we're trying to educate people and for them to have more evidence and data-driven policies for countries. I think that the element of this kind of mistrust and actual disinformation will need to be addressed, and we need to work with social scientists, behavioral scientists, and as well as with communities to really understand this whole phenomenon. And particularly young people, I think we really need to work with young people to improve scientific literacy, health literacy, get them to think more rationally, to question information they see which, just comes out of the blue and doesn't seem to be logical. So the WHO has actually launched a big program of work in this area that we call infodemic management, that's really looking into the root causes, encouraging more research. It's a very multidisciplinary area of work, but certainly one of the challenges.
I was going to say, have you personally faced attacks?
I have, and I've faced attacks for just ordinary things which I thought, should be non-controversial. So making statements that are based on the available evidence and facts of that time. And of course, we have to change and evolve as data has been coming in. And that's, again, I think been one of the things of the pandemic is that we've had to change and adapt our guidance as we go along. And perhaps that confuses people who don't understand how science works. And they may think that you were wrong to say that a few months ago, or that you don't know what you're talking about. So I think explaining also the process of science, and that it's a continuous learning, continuous evolution, continuous questioning, and as more data comes in, we must change.
Yes, I mean,
our views.
In terms of the attacks on you, as information has changed, how have they come to you? Has it mainly been via social media? Could you give me a flavour of that?
It's mainly been through social media. And I think, again, this is the first pandemic, I think, in the social media age. And so I've seen both the positives and the negatives. The positives, of course, have been that you can get your messaging across, that you get a lot of information from the social media, that you can be updated, practically in real time to what's happening around the world. The downside is that you also get a lot of false information out there, and then you get these communities of people who organize themselves to attack. And that's what happened to me. I was attacked on social media by a group of people for whatever their vested interest was. I don't know what it is, but they genuinely believed that I was misinforming, whereas I was communicating the WHO guidance based on all of the data that we look at.
Do you get very frustrated by that? You're one of the world's top scientists and you're being accused of lying. I mean, when you go home at night, do you vent? Do you get angry? What's your reaction to that? It must be frustrating, to say the least.
It is very frustrating, and as I said, I was extremely surprised and very disappointed.
Yes, I mean, of course, and that is the wider focus. You say, of course, it's because of social media. I think what you mean by that is that's the way they can get in touch with you, of course, as well as reading other information. But who do you blame for the politicization of scientists and science?
I think it's a combination of factors. I think it's the first time that science has played out on the front pages of newspapers. So in general, people are not used to, when was the last time that vaccine development was discussed by lay people? There are hundreds of childhood vaccines and other vaccines that have been developed and used. We've never gone step by step, day by day into looking at these things. So I think one is the understanding of the process of science, understanding about transmission. All our understanding about the virus has evolved. And as that's evolved, our communication has changed, our messaging has changed. So I think that's the first thing. The second, I think, is the issue that you brought up is about the environment of trust. And you can see differences between countries in how much populations and communities trust their leaders and their governments, and how well governments have communicated their messages, how transparent they've been, how they've explained to people.
Let's talk a bit more about the World Health Organization then and trust levels. A key question, I bet you get asked this all the time, how did COVID start? What is your understanding as the chief scientist of the World Health Organization?
So from, historical experience, we've seen that many or most viral infections that newly emerge have been zoonotic infections. So they've come from an animal host, either directly or through an intermediate host to infect humans. And, starting from HIV, from the Zika virus, from Ebola, from, of course, SARS and MERS, the other two major coronaviruses that have infected humans. We've seen that they emerge from an animal and then sometimes through an intermediate host. So in this case, I think the genetic sequences of this virus are still pointing towards an origin perhaps from bats. That's the closest homology that we found in sequence. Bats have a lot of coronaviruses, and so there's about 96-97% similarity. But I think what we haven't got is the exact how, when, and where did that jump happen from animals to humans. And that's important to understand in order to prevent future pandemics.
Do you not think it's a bit odd that we don't yet know?
It's not that odd, because even in the past, it's taken many years actually to understand the origin of viruses. It takes several years to know that SARS came from civet cats and MERS was spread from camels. And similarly for HIV, it took a long time to understand that it came from chimpanzees in Africa, and the chimpanzee viruses then were able to infect humans and changed.
If I may just intervene at that point, of course, it's important to bring up the idea, the lab theory, where there's this concern that it's been leaked from a lab by accident or not in China with scientists working in Wuhan. Joe Biden has asked US intelligence to look into this. US intelligence now believe the virus escaping from a lab is at least credible. Have you ruled that out at the WHO?
Nothing has been ruled out. As you know, we've had this group of scientists, an independent international group of scientists that have been working on this. They've made 2 visits to China. The last one was in February of last year. There was a very detailed report that was presented with several options. And clearly lab leaks can happen, have happened in the past, and one, cannot rule it out. So what one needs is to look at the weight of the evidence. And the scientists who went to China and worked with local Chinese researchers felt that the most likely scenario was the zoonotic, the animal, that it's come from an animal. Now, whether it's a wild animal, a domesticated wild animal, or a domestic animal, but is it a bird or a bat, that we don't know. But the scientists, the majority of them felt that was the origin, but they didn't rule anything out. They had it on the list of hypotheses and said, we need to examine all the data and do more studies in the field in China.
You brought up the word trust and World Health Organization. Last year in August, the UK's Sunday Times newspaper published a damning investigation into what they called China's power grab of the World Health Organization. The key allegations amongst that centred around the idea that having been embarrassed by the SARS outbreak and the World Health Organization's very public criticism of China over that officials from China ever since have done as much as they can to have as much control at the WHO. As the chief scientist of the WHO, what do you make of that allegation?
I can tell you that there's no truth behind those allegations. The World Health Organization, first of all, is made up of its 194 member states, and we are governed. In fact, we have now going on in the building behind me, the executive board, where of course, the executive board consists of 34 of the member states that rotate. They are the ones who make policy. They determine the way that WHO works. They set our priorities. They agree on our funding, and we then follow the program of work that's set out. We also, another thing that's important to understand is WHO works through global networks of scientists. And so we have thousands and thousands of scientists and researchers and doctors from around the world who serve on our different committees, and they provide the recommendations that go into our guidelines. So it's not just a group of people in Geneva who can be influenced by any country. So we try to be as open and transparent.
So you feel satisfied that there hasn't been any undue influence by the Chinese authorities over the WHO? Because another reason I ask is you mentioned that fact-finding mission to China, and I think this is very important about trusting the WHO and continuing to have trust in it as an institution. Peter Benenbarek, a Danish scientist who led that fact-finding mission for the WHO into the origins of COVID in China, said the team was put under pressure by Chinese scientists who made up half of the investigating team. He told journalists in August 2021 that those Chinese scientists did not want the lab leak theory mentioned at all in the report. Now, I must mention, he then retracted that statement, saying it had been mistranslated, but he refused to comment further. The issue is that doesn't help with this perception that has built up with some that the WHO is too close to China and hasn't been able to trust what it's been told in China.
So, we've said from the beginning, and this is why it's important for countries now that are going to negotiate a pandemic treaty, right? The special World Health Assembly that was held on the 1st of December came up with this report called A World Together, which is really looking at the future and how do we want it. I mean, things could have gone much better, and what we need is for countries to cooperate. Now, tomorrow there may be a new outbreak, emergency in some other country, right? We don't want the same thing to be playing out over and over again. So the world needs to come together. The member states of the WHO, the 194 member states, need to come together to agree on a set of rules. It's not WHO that can make the rules. They need to make the rules to give powers to WHO to do the kind of investigations that will benefit everyone. So those are the kind of discussions that will happen.
Well, that sounds, sorry, if I may, that sounds like you don't think you've been able to do the investigations you can. A slightly different question is, do you think China has been open enough this time around with the WHO?
It's about the powers that WHO has. It's about the powers. So we work with countries in a collaborative manner.
So you need more power?
Yes, I think more power, especially to investigate outbreaks that could lead to pandemics, certainly.
Do you think the WHO has been the leader it could have been at this time? There's also been some criticism coming away from the China side for not declaring a global health emergency until the 31st of January, I believe, in 2020. Some people saying it's been too slow, too cautious, not muscular enough, in fact, almost too collaborative to move to be a leader at this time.
Well, you can always, in retrospect, I think that things could have been done differently or things could have been done better. But the fact is that when a public health emergency of international concern was declared, there were less than 100 cases of SARS-CoV-2 infection outside of China, and no deaths had occurred. And again, I come back, it's the emergency committee that advises the Director General, whose recommendations the DG then follows. So when they first met on the 23rd of January, the majority felt that it was not time to declare a public health emergency of international concern, and that the DG convened them again a week later. And that at that point they said, well, it looks like it is spreading outside China, and they then made the recommendation. So again, it's a group of scientists who looked at the data that was available at that time and made the recommendation to the DG. After that recommendation was made, the announcement on the 30th of January, very few countries took it seriously. Most countries just went about, the normal, nobody was preparing for what happened later, a few weeks later in Europe and then in the US, because at that time, so valuable time was lost between the time that the public health emergency was declared and cases started climbing in many of the Western countries. So even though that was the highest level of alert that WHO can make.
Just as I'm asking you about the start of the pandemic and the declaration of it, I think a lot of people want to hear about the end of it. You know, they want to know, when will we know it's over, or certainly at a point where you can say we're not in a global pandemic. What is that point?
So I don't think anybody can predict when that point will come. What we're looking at scenarios. And the scenario that we hope will play out will be that in 2022, we will have enough people vaccinated around the world to have that wall of immunity. And we know now that the vaccines we have currently are very good at preventing severe disease and death. And so if we can build that immunity, which I have to remind everyone that 3 billion people around the world still haven't had their first dose of vaccine. I mean, that's shocking. Even though we've had almost 10 billion doses administered worldwide. It could either circulate at a low level, infect people, some people get ill, but not a lot of people get severely ill. It could also, like influenza, have seasonal peaks in the future. Or there's a bad scenario as well, that we might get another variant after Omicron that is not the mild variant, but we could get a variant that's as transmissible or more than Omicron, but also is more virulent or more deadly. We can't rule that out. And that's why we're saying, let's not declare the pandemic over, as some people are doing now. It would be foolish to drop all our precautions that we've been taking all of this time. We need to continue that, and hopefully by the end of 2022, we'll be in a much better position. Because let's remember, this is a pandemic. So one country cannot do something without thinking that they won't be affected by what goes on in another part of the world. A variant can arise anywhere and come back, and you're back to square one. So I think it's good if the whole world moves together. We still need to be cautious, but it's too early to declare the pandemic over.
You just mentioned, of course, the billions of people who don't even have a first dose in their body of the vaccine. What do you put that down to? Is it the situation with patents? Is it the situation with countries, richer countries hogging vaccines? What is the block there?
Well, in one phrase, if you have to describe it, it's vaccine inequity, vaccine nationalism. It's a combination of the things you said. I think, the beginning, obviously, vaccines were in short supply. They were limited. And it's incredible, actually, that vaccines even got developed in a year and that we've had billions of doses produced. If those hundreds of millions of doses we had in 2021 had been distributed equitably the way that the WHO had laid out the framework, let's protect all the vulnerable people around the world first, doesn't matter where they live, so we can reduce deaths. And then we can start vaccinating the other age groups, coming down, to adults and adolescents and so on. Then maybe we would not be seeing new variants now. Maybe we would not be still seeing 50,000 deaths a week today.
Do you think that the West, the richer countries, hogging vaccines has led to the variants?
Yes, I think we can say that. 85% of people in Africa have not received their first dose. This is a recipe for letting new variants develop because the virus is transmitting unchecked. And so I hope in 2022 that we can focus on bridging that gap.
Have you had COVID?
Yes, I have.
How was that? When was that in the pandemic, if you don't mind me asking?
It was quite recent, and it was. I was lucky that it was relatively mild, and I could isolate at home and self-monitor myself, and I felt better in about a week.
Okay, because of course, so many more people now have had the experience. I just thought to ask you, I suppose, how it was for you, having been working so hard on this.
Yes, I must say that it was worrying because one knows so much about the paths that COVID can take, the complications that you can have, and also the possibility of long COVID. So I think having been vaccinated really did protect me. Of course, I was taking all the other precautions, but still, sometimes the virus still gets to you. And I had, yes, mild symptoms, I should say. And I kept working throughout, actually, even in isolation. I was able to do that.
Okay, well, I mean, that's good to hear. We wouldn't want to hear it any other way. But I suppose it's just when you work on something and then you experience it, it can change your view and also your kind of understanding and your empathy levels with it. And of course, the reason this has become, so real to so many is because now more and more people sadly know people who've suffered very badly with it, or sometimes in the worst case, lost loved ones. Has that happened in your life at all? Have you lost anyone to COVID?
Indeed. I mean, I think during the Delta wave that happened across the world and in India last year, I lost many dear friends, classmates, and family members to COVID, yes. So it did impact me also personally.
I'm very sorry to hear that.
Thank you.
It's just, I suppose, the reality. We can talk all about the politics, we can talk all about the science, the lockdowns, but at the end of the day, it's just for other people who, I suppose, haven't had any exposure to the science. Like you say, we never used to talk about epidemiology, we never used to talk about vaccines, and then it just became so real, and how we get our heads around that. Psychologically, it's been very, very difficult for people, and I imagine at the same time as working on it, you've experienced that.
Exactly. I think so many of my colleagues have been working round the clock as well. We have to remember the healthcare workers, of course, who've put themselves, and that's why I said my classmates, doctors, have died during this pandemic, close friends. And of course, people at WHO and all the other public health agencies and the ministries of health. So it's had huge mental health impacts both on people who've been working and seeing a lot of suffering on the front line, but of course also families, young people in particular. So I think as we think about coming out of this pandemic, we have to focus not just on the health impacts of COVID and what we need to do to build health system resilience, but on the broader economy, on inequalities in our society, which have really come to the fore. I mean, it's, for me, seeing some children that have been out of school for the last almost 2 years now, I really worry about their future, particularly poor children who have not had access to online education, and whether they'll be, into child trafficking or early marriages and so on. So those are the kind of things I hope that countries will thinking about the most vulnerable and how to protect them and how to build social safety nets in the future.
Do you think we'll ever get over this? Of course, we can get through it and hopefully get around it in some ways, but those ramifications we're only just starting to think about, aren't we? The social, educational, the impact on this generation coming through.
We will come through it, we will get out of it, but I think it will take longer than people are currently planning. People think we'll be out of the pandemic by the end of this year. Yes, I mean, the health impacts of COVID, hopefully we will get over it. We're not going to get rid of the virus. We will learn how to live with it, like with other respiratory viruses. But it's the other impacts on the economy, on society, and particularly on the vulnerable. This is the time to really start planning. And I particularly hope that we can keep children at the center of this rebuilding. And the other thing is not thinking about going back to how we lived in 2019, but to imagine a new future where we will continue to be very cautious and looking at to see whether there are new variants or viruses emerging. I think we'll have much better surveillance systems globally as a result of this pandemic. And we can also put our masks on. We know that even if you've had an ordinary respiratory infection or a flu, it's good to keep your mask on because at least you're not infecting your family and co-workers. So I think we've learned a lot we should take into the future.
Thank you so much for talking to us. I think that's a very powerful point to bring our conversation to a close on, with regards to how we might not go back, but there may be learnings from this time to take forward. And thank you for sharing the benefit of your research with us.
Thank you.
Thank you so much for being with us. Until we meet again, stay safe and goodbye.